So everything, socioeconomic status is everything. Their public health has called this social determinants of health, and social determinants of health account for most healthcare disparities overall. And certainly this includes and is the case with prostate cancer disparity. Social determinants of health are those conditions or those things that we are born in and live and grow and educate our communities. So our education, our employment, our income, our social support, our community resources, and our safety, for example. These social determinants or socioeconomic factors determine our exposure to risk, okay, our risk of exposure, and our access to resources to help, okay, with our medical conditions. They influence access and quality of medical care that we receive, patients receive. And social determinants of health are absolutely shaped by the distribution of wealth and influence in our society. They're shaped by programs and policies that have been in place for eons and eons, okay? Where does money go? How are resources distributed? And guess what? That brings it all back to structural racism, which are compounded and chronic inequities that still exist and persist in society. And even if legally policies have legally on paper said you can't discriminate based on race, there are inherent practices that are discriminatory or inequitable, that are based on race. And so that trickles into our social determinants of health, where communities are either invested in or divested in, okay? My community is thought to be a poor investment, then we aren't gonna have public works and physical education. We're not gonna have good nutritious sources. I'm gonna be in a food desert. Where studies have shown that Black and brown communities have lower proportion of nutritious food, access to food, lower proportion of playgrounds, higher risk of environmental exposure or environmental toxins, almost 1.5 times more than predominantly white communities or non-minority communities, and are more have more density of like liquor and tobacco stores. So all of these and less access to medicine. All right. I love this quote by Dr. Damon Tweedy. He was the author of author of Black Man in a White Coat. He says being black is bad for your health. And what he's basically saying is that structural racism affects our access and exposure, our housing, our education, nutritious foods, all of those things that I've just listed and given examples. And that absolutely affects our risk and our risk of diseases.